Hello, I'm Trisha Carrick Antonucci, and today is a very special day. It's Father's Day. I wanted to wish a very special Father's Day to our father of functional neurology. I've had the pleasure of working with my father for over 20 years. Some of my fondest memories were organizing and observing grand rounds, as well as having the opportunity to recommend new curriculum to assist our scholars to assist their patients. Dad, today I want to talk a little bit about a new program that I thought was very fitting to announce on Father's Day: clinical skill acquisition for the healthcare practitioner. This program covers many exciting topics: cerebral vascular disease, clinical introduction to ischemic and hemorrhagic stroke, movement disorders, cerebral and ataxic disorders, headache and face pain, trauma of the nervous system, pain syndromes from head to toe, and something that is going to make our scholars very excited that they've been waiting for quite a while: coma. Can you please tell us a little bit about the format of this program?
Sure, Trish, and thanks for the happy day. And as you know, I think that you make every day Father's Day, so I appreciate that.
Thanks.
So this program will be unique in that I'm going to share the things that I do on a day-to-day basis in this course by talking about the subject areas that you mentioned. And these subject areas are not picked by random. These are the areas or the patient complaints that I see on a daily basis for the last 4 decades and to the present time. So with all of them, we are going to talk about the things that I find that I need to know to be able to do the best job that I can do and to serve the patients to the best ability. So we'll start with an overview of the epidemiology of each of the conditions, and we'll talk about what are the things that you will observe in these patients and how to observe them best and how not to make errors and miss things. We'll talk about the differential diagnoses of other things that can present in a similar manner so that we have a fluency and understand the evidence-informed basis of it. And then more importantly, we'll talk about what you can do as a healthcare provider and what is the best treatment. Now, fortunately, the topics are things that I do every day. So we'll be talking about things that I can do pretty well, which is most of our audience does, similar things that I do. And then we'll talk about the prognosis. What can you expect? How to be empathic. The more you do these things, the more terrible neurological disorders that you have that oftentimes have a terminal ending. How to understand that, how to understand how all disorders, whether they be pain or sports concussion, affect not only the patient that you're doing, but their family, their friends, society, and you as a part of this team. And then very, very importantly, what can we do to prevent the individual conditions that we've addressed? So those 6 areas will be the key in our course instruction. And we're going to check those boxes off and create a degree of fluency that we think, and I personally know in my soul, will make people better practitioners.
Oh, we are so excited. And it's going to be 15 hours of learning. So thank you so much for extending that lengthy time for us for this particular program. One more question that I know you get all the time: how did you reach your clinical success?
Well, I did get asked that a lot, and I think there's so many different parts of it. But the basic component is hey, I grew up in a world without Facebook and social media, so that even if you wanted to talk about yourself, which is a little, perhaps pathological, you couldn't, which is a saving grace. And if other people wanted to make posts, they couldn't. So my success was really based upon word of mouth from patient to patient, and it expanded so that in a reasonable amount of time, I was being talked about throughout the globe, and attracted patients that came to see me from around the world. And I remember the first time, I had patients from the Soviet Union when it still was closed, or from China. You remember them because you were, although you weren't working for Carrick Institute, you certainly were living it. And it was pretty exciting when we would see, dignitaries and things like that. So the part of success is like, why did people talk about me or other people? And it wasn't because the shine of my shoes or the color of my tie. It was based upon outcomes and how the things that I did had a consequence of changing people's lives. And most of the talk was positive as a consequence of the referrals. So that was successful. And I think not letting that type of success get to my head and realizing that I could do it better was a very key part of my ultimate success, something that I do to this day, that I'm not satisfied with the miracle. I want more of it and I want to do it better. So being humble in regards to that is such that people will talk about you. And you can imagine if they're talking about you and they're posting on their social media, you probably will not know what sleep is like in a very short period of time.
Well, I know many of, during grand rounds, many of our scholars that were attending would say, how does he, how do I miss the things that he just gets on the spot? So what is your secret?
That's a question that I get asked literally every day of my life. And people that are experienced, will look at it, and then I have been lucky, I guess, to make observations they haven't seen. So the key is learning how to observe. That is the key. And there's a methodology in that. I'm going to try to impart that in this course. So it's always easy to see something when you point it out. It's always easy to see it. The key is to learn how to see it yourself and to take that observation and make a difference with it. So I need to do my best to show people how I do it. And I think it's transferable.
Well, I certainly appreciate you, and I know our scholars do. And we can't wait to see everybody at Clinical Skill Acquisition for the Healthcare Practitioner. And again, a very, very happy Father's Day to you.
Well, thanks so much. And I'm really excited to share my life's work, the things I see every day with things. And I love this Father's Day. So thank you again for that. It's pleasant. It's always good to see you, even at a distance like this. So thanks again.
Thanks.